Did you know that physical therapists can be a key healthcare provider in your gender-affirming care? In this video, we're going to be going through the role that physical therapists can have with both surgical and non-surgical gender-affirming care. I'm Dr. Alex Hill. I'm a board-certified physical therapist. Make sure that you subscribe to my channel for more videos on pelvic health and gender-affirming care. Gender-affirming care includes social, psychological, behavioral, and medical interventions to support and affirm a person's gender identity. Many physical therapists or PTs, especially pelvic health PTs, have additional specialized training to provide gender-affirming care. And gender-affirming care is way more than just surgeries, although this does get a lot of press. So let's start with talking about surgeries, and then we'll get into some of the non-surgical related care that PTs can help with. Top surgeries involve a surgery that either removes or augments breast tissues or reshapes the chest to create a more masculine or feminine appearance. Before your surgery, PTs can improve and optimize your posture, your upper body strength, and your mobility of the shoulders, the neck, and your ribs. After the surgery, PTs can help with decreasing your pain, addressing any scar tissue to make sure that it heals well, work on improving your posture, and improve the mobility and the strength of your shoulders, neck, and your trunk with exercises and hands-on manual techniques. Bottom surgeries, also called genitourinary reconstruction surgery, can be very varied. They can be feminizing or masculinizing, and examples include a phalloplasty, metoidoplasty, scrotoplasty, vaginoplasty, vulvoplasty, and clitoroplasty. Before your surgery, a pelvic health PT will assess your posture, your pelvic floor muscles, your trunk and hip muscles and joints, and based on the exam and what type of surgery you'll be having, your PT may recommend pelvic floor exercises to work on relaxation, coordination, or strengthening the pelvic floor muscles. They can also provide you with education and tips on optimizing your bladder and your bowel health before surgery that you can then carry through to after your surgery. They can also work on improving your trunk and hip mobility and your strength for better surgical outcomes. After your surgery, your needs are going to vary depending on the type of surgery that you had. After a vaginoplasty, for example, you'll need to see a pelvic PT to go through dilator progressions. For more information about dilators after vaginoplasty, I'm including a link to the video in the description below and at the end of this video, where I go step by step on how to actually use these dilators. Besides dilators, other treatments that can be utilized after a bottom surgery include pelvic floor exercises, retraining your bladder to address any type of bladder concerns that you might have, hands-on manual techniques for scars or graft tissue restrictions, and exercises to improve your mobility and your strength. All right, so we talked about top and bottom surgeries, but what about for non-surgical treatment? So some common practices for gender-affirming care are tucking, binding, and packing, as well as hormone therapy. So let's talk about how PT can help with these. If you're doing chest binding, this can often cause issues with your posture, rib movement, and cause pain at the chest and the trunk and even your back. A PT can assess your posture, go through safe binding practices, and provide you with exercises to improve your posture, your breathing pattern, strength, and your mobility. Keep watching till the end of this video for exercises that you can do if you're chest binding and if you have any pain with that. If you do tucking, you might have some pelvic pain and maybe issues with urinating. A pelvic health PT can assess your pelvic structures, your hips, and the pelvic floor muscles to see where your pain or your symptoms might be coming from, and provide you with some tips for decreasing your symptoms, as well as exercises and hands-on techniques to help with improving your symptoms and any impairments that they might find on the exam. And finally, depending on the type of hormone therapy that you're doing, you may benefit from an individualized exercise plan to address any weight changes, loss of bone density, and any pelvic symptoms, including pelvic pain, bladder, or sexual symptoms. Thanks for watching this video. I hope that it was helpful in understanding the important role that physical therapy has in being a part of your gender-affirming care team. Please like this video and subscribe for more content on pelvic health and gender-affirming care.